They sent her to room 7 because they thought it would be funny. Welcome to Steady Badge's Stories. I'm glad you found this one. If you've ever been handed the most impossible task in the room, not because anyone believed you could do it, but because watching you fail was supposed to be entertaining, then stay with me tonight. Hit like if you want more stories like this, subscribe so you never miss one, and drop a comment telling me where in Canada you're listening from. I want to know how far this story reaches. Now let me tell you about Rowan Mackay. Rowan Mackay had been a nurse at the Rideau Veterans Medical Centre in Ottawa for exactly 16 days, when Bryn Chalmers decided she was worth humiliating. It was not personal. That was almost worse. To Bryn, Rowan was just the new hire with the forgettable face and the cerulean blue scrubs that were half a size too big. She kept to herself. She did not laugh at the jokes in the break room. She took her charts to the corner and read them carefully, twice before she said anything. In 16 days, nobody had learned much about her except that she was quiet, and quietness, in Bryn's experience, meant soft. "Give the new girl room 7, Bryn said, loud enough for the whole nurses' station to hear. "Master Corporal Okonkwo, let's see what she does with that." The laughter was immediate. Spencer Rowe, the second-year resident with the expensive sneakers, looked up from his tablet and grinned. Two nurses near the medication cart exchanged a look. Dr. Harlan Vick stepped out of the physician's workroom at that exact moment, unhurried, already irritated by something, and surveyed the scene the way a man does when he has been told his time is precious and everyone else's is not. "Parker," he said, then corrected himself without embarrassment. "McKay, room 7, vitals and a pain assessment, don't expect much." Rowan took the chart without expression. "Master Corporal Darius Okonkwo, 39, former JTF-2 operator, traumatic brain injury and partial hyalination in Kandahar Province, 2019. Aphasia, receptive and expressive, moderate to severe. Left below knee amputation, prosthetic fitting ongoing. Admitted after collapsing during rehabilitation assessment. Fever, elevated heart rate, significant chest wall tenderness, labs pending." The chart had 3 red-flagged notes: combative, uncooperative, high risk for staff safety. Rowan had seen those words before. They almost always meant someone had stopped trying to understand him. She walked down the corridor, while the laughter from the nurses' station followed her. The Rideau Veterans Medical Centre smelled like floor wax and old coffee, and something underneath both of those things. A particular kind of patience that veterans carried with them into buildings that were never quite built for what they had been through. Men and women sat in chairs along the walls. Some of them wore pins on their collars. Some of them stared at nothing in the precise way of people who had learned that stillness was safer than movement. Rowan understood that. She did not let it show. She stopped outside room 7 and looked through the narrow window. Darius Okonkwo sat with his back against the wall and his eyes moving. Door, window, ceiling corner, the call cord, the IV port, in a quiet circuit of threat assessment that most people would not have recognized as such. He was broad across the shoulders even in a hospital gown. His right hand rested on the mattress. His left was near his lower ribs, not pressing, just aware. His face was still. His eyes were not afraid. A whiteboard beside the bed read, "Patient has aphasia. Use simple language. Speak slowly." Beside the whiteboard, a tablet lay face down on the floor. It had been thrown recently. Rowan knocked twice on the doorframe. His eyes went to her hands first, then her face. Good, she thought. He's watching the right things. She entered slowly, palms visible, body angled sideways so neither the door nor the bed was blocked. 2 orderlies standing near the window looked relieved in a way that told her they had been there too long and accomplished nothing. "You can go," Rowan said. The older one blinked. "You sure?" He threw the tablet at Dr. Vick's intern this morning. "I'm sure." They left quickly. Rowan kept her eyes on Darius. She did not speak yet. She moved the visitor's chair so it was visible to him, sat down without taking anything from her pockets, and waited. Darius watched her. After a moment, she leaned slightly forward and held up one finger. One question. She pointed to herself, then to him, then made a small gesture. Open hand, slow sweep, your rules. Something shifted in his face, not trust, the very first edge of it. He tapped the mattress, 3 short, 2 long, a pause, then 3 short again. The room felt different after that. 3 short, 2 long, 3 short was not ASL. It was not Morse code in any standard configuration. It was a field tap code. Shortened, modified, the kind of thing that gets developed between small teams in low-light environments where radios are off and silence is survival. Rowan knew it because she had used it. She had helped teach it once to a group of soldiers who trusted her with their lives in places that did not appear on public maps. She tapped back, 2 long, 1 short, I hear you. Darius went completely still. His eyes dropped to her right forearm. She was wearing long sleeves, but the cuff had shifted when she leaned forward. A scar ran along the inside of her wrist, not a surgical scar. Burn tissue, old and faded, the shape of a blast signature that any combat medic would recognize. He tapped once, identify. Rowan should have looked confused. That would have been the safe thing. But his oxygen monitor had just dropped to 93, and his hand had pressed harder into his ribs. She tapped back, hold, I see you. The breath Darius let out was slow and careful, and not quite steady. She stood, moved to the bed, and asked with a gesture, may I check? He nodded. She wrapped the blood pressure cuff without rushing it, no surprise pressure, no cold instrument against skin that remembered worse things. She counted his respirations herself because the monitor's number felt wrong. 26 breaths per minute, too fast for someone sitting still. BP 162/96, pulse 100.7. Oxygen 93, dipping toward 92 as she watched. She listened to his chest after he gave permission. Left lung, coarse but present. Right lower field, diminished, not absent, close. She stepped back and pointed to the space below his right arm. Pain? Darius's aphasia meant that words often came out transposed. He might say blue when he meant pressure, falling when he meant sharp. She had read the chart notes. Staff had interpreted his wrong word substitutions as confusion or aggression. She was watching his hands now, not his mouth. He tapped, short, long, wrong, getting worse. She tapped back, since when? 3 short, morning. Fell. He shook his head, pressure inside right. Rowan looked at his chart. The last physician note from Dr. Vic, timestamp 4 hours ago, read, patient agitated and non-communicative, likely anxiety-related presentation, monitoring continued, no acute intervention indicated. She went to the door. Dr. Vic was at the nurse's station, laughing at something on Spencer's phone. He looked up when Rowan approached, and his expression settled into the particular blankness of a man who had already decided not to be impressed. Room 7, Rowan said. Master Corporal Okonkwo, his status has changed. Diminished breath sounds, right lower field. Oxygen dropping. Fever holding at 100.7. Chest wall tenderness on the right. He needs reassessment. Vic looked at her for a long moment. He needs a sedative and a speech pathologist. He needs imaging reviewed. I reviewed his chart this morning. His chest, not his chart. Bryn made a small sound, the kind that was not quite a laugh but was not quite disapproval either. Spencer said quietly, she's been in there 15 minutes. Which makes her an expert, Vic said. Document anxiety, order a breathing treatment, come back when there's a real problem. Rowan looked at him steadily. There is a real problem. Vic's voice went flat. You are new here, Mackay. This patient has been flagged across 3 departments for aggressive behavior and fabricated symptoms. He threw a tablet at a resident this morning. You have been a nurse in this facility for 16 days. I have been a physician for 19 years. I think I know the difference between a medical emergency and a difficult patient. Rowan said nothing. Do you want to keep this job? She said, I want to keep my patient. She went back to room 7. Darius was watching the door when she entered. He tapped once. Doctor? She answered honestly, no. He tapped again, something slower, more careful. The code shifted. It was no longer the general field tap. This was something more specific, unit-specific, the kind of modification that only got used within a single team, on a single rotation, in a single theater. Her blood went cold. She recognized it. She had helped develop it. Darius tapped the sequence again, then one word, sounded out slowly against the sheet, CROW. Rowan's hand stopped moving. He tapped again. Crow, is that you? It was not a question. It was the kind of recognition that came from somewhere, much deeper than memory. His eyes had changed. The threat-scanning circuit had stopped. He was looking at her with something no chart notation had ever come close to describing. She should have denied it. That would have been safe. His oxygen dropped to 90, the monitor chirped. She tapped back, hold, stay with me. Darius's face tightened. He pressed his palm flat against his lower right ribs and tapped with 2 fingers. Pressure, worse now. Rowan grabbed oxygen tubing. He did not flinch when she placed it. He had already nodded. His saturation climbed back to 93, then stalled. She hit the call button, no answer. She walked back to the nurse's station. I need a rapid response for room 7, she said, now. Bryn looked up. I'm not calling rapid response because you're spooked by a difficult admission. His oxygen is at 93 and falling. Right lower breath sounds are diminished. He has right-sided chest wall pain that worsened through the morning and he has a fever. That is not anxiety. It's consistent with his previous presentations. His previous presentations weren't documented properly. Nobody listened to his chest correctly because he was labeled before anyone walked through the door. Spencer said, careful and quiet. Bryn, she's not wrong about the sound findings. Bryn's expression darkened. Dr. Vic came around the corner with a medication chart in his hand. "McKay, the breathing treatment should be underway by now." His SAT is 91 as of 3 minutes ago, trending down. Vic's jaw shifted. "You're catastrophizing." "I'm charting. Would you like to see it?" He followed her back to room 7 because he had no choice. The monitor read 90, pulse 131. Darius's lips had a slightly gray cast at the corners. His eyes went to Rowan when she entered and stayed there. Vic looked at the monitor, and then at Darius, and then back at the monitor. Something crossed his face, the briefest fissure in the certainty. Then pride sealed it again. 2 milligrams lorazepam, he said. "He's agitated. We need to calm him down before we can get an accurate picture." Darius read enough from the word lorazepam to understand. His face hardened. Rowan stepped forward. "No." Vic turned slowly. "Excuse me. No sedation until we've ruled out a respiratory cause. You cannot sedate a patient who is already showing signs of air trapping. You do not countermand me in my own ward. You do not sedate a man who cannot breathe and call it a clinical decision." The monitor alarm began, not the aggressive one, but the low, persistent one that meant something had crossed a threshold. Oxygen 87. Rowan hit the rapid response button on the wall before Vic could reach it. "Rapid response to room 7, rapid response to room 7. Vic lunged for the cancel switch. Darius shot out one hand and caught his wrist, not hard, not threatening, just enough to stop the motion. Then he looked at Rowan and tapped once against his own palm. "Let it ring." She signed back, one open hand flat. "I hear you, hold." He released Vic's wrist immediately. The obedience in that, the absolute precision of it, silenced the room more completely than any alarm. The rapid response team arrived fast. Dr. Ingrid Solberg, the attending trauma surgeon on call, came first and moved to the bedside with the efficiency of someone who had learned not to waste seconds. "What are we looking at?" she asked. Rowan spoke clearly. 39-year-old male, aphasia from TBI, partial hearing loss, fever 100.7, pulse 131, oxygen 87 on low flow, dropping, right lower breath sounds diminished on auscultation, right-sided chest wall tenderness, onset this morning, no fall, no direct trauma reported, worsening through the shift. Vic said, "Anxiety presentation in a high-acuity behavioral patient." Solberg put her stethoscope to Darius's chest. She moved methodically, left, right, upper, right, lower. She took the stethoscope off and held it in her hand for a moment. "Anxiety doesn't remove a breath sound," she said, not unkindly, very clearly. The portable X-ray came in 90 seconds after Solberg called for it. Oxygen 84 while they waited. Rowan stood where Darius could see her. She tapped the slow pattern, slow breath, "Eyes here, still with you." He tapped back, weaker now but deliberate, "Copy." The image loaded on the portable viewer. Right-sided pneumothorax, moderate, possibly under tension given his vitals. Solberg said, "He needs decompression." Vic stared at the screen. His hand did not move. Rowan understood his face in that moment, not stupidity, not malice, but the particular paralysis of a man who had been wrong loudly and in front of witnesses, and whose pride was still insisting on finding a way to be right. "He was at 84, Solberg said. She did not look at Vic when she said it, she was already preparing. Oxygen 81, pulse 144. Darius's eyes found Rowan through the crowd around his bed. She tapped once. "I'm here." He tapped back. "I know." The decompression went cleanly. Solberg was efficient and unhurried in the way of surgeons who have done a thing so many times that competence looks like calm. The hiss of released air was audible to everyone in the room. Darius's chest rose with a completeness it had not managed in hours. The monitor climbed, 81, 85, 88, 91. The color came back to his face in increments like light returning after a power cut. Nobody spoke. The room had the quality of a place where certainty had recently broken and the pieces had not been swept up yet. Spencer looked at Bryn. Bryn looked at the floor. Vic looked at the wall. Solberg pressed the back of her hand briefly to Darius's forehead, a gesture older than medicine. Then she turned and found Rowan's eyes. "Good catch," she said. 2 words. They landed harder than anything that had come before them. By that afternoon, the hospital had invented 4 different versions of what had happened. The new nurse had caused a scene. The new nurse had saved the soldier. The JTF2 patient had attacked Dr. Vic. The JTF2 patient had only cooperated with her. Most people agreed on one thing. Something had passed between Rowan Mackay and Darius Okonkwo that nobody in the building could adequately explain. Rowan documented everything, vital signs, exact times, every refusal to act and every reason given. Facts were cleaner than anger. At 4:30, Bryn found her in the supply room. "Administration wants to see you," she said. "Is he stable?" "Solberg's with him." "Then I'll go." Rowan moved toward the door. Bryn blocked it for 1 second. "Mackay." A pause that took effort. "I didn't think it was serious. The way I assigned rooms this week, I thought it would toughen you up." Rowan looked at her evenly. Humiliation is not a training method. It only looks small to the people watching. Bryn flinched, but she stepped aside. The administration meeting was on the 3rd floor, in a room with framed values on the wall: respect, integrity, excellence. Rowan always noticed when values needed to be laminated. People living them rarely needed reminders. Morris Flint, the hospital administrator, sat at the head of the table. Vic was to his right. Spencer sat further down with his arms crossed. Bryn took the chair nearest the door. Flint said, "Nurse Mackay, please sit." "I'll stand, thank you." Vic exhaled. "We are here to review an incident involving unauthorized rapid response activation and potential overreach during a patient care event," Flint said. "We are here to review a patient who nearly died because his medical status was dismissed across multiple assessments today." Vic said, "You are not qualified to make that characterization. His oxygen saturation at the time of decompression was 81%. That characterization makes itself." Flint wrote something. "Did you activate rapid response contrary to the instruction of the attending physician?" "Yes." "You seem unconcerned." Rowan said nothing. She had been in rooms with much higher stakes than this one, and had been taught that silence, properly held, was its own form of answer. Vic opened a folder. "There is a secondary concern. During the care event, the patient appeared to communicate with you in a manner that other staff found unusual. Non-verbal signals. Afterward, he said a word. Crow. He was pointing at you." Flint looked up. "What does that mean?" "I think you should ask him." "I'm asking you." "I don't know what he meant." Vic smiled. "That's a lie." Something shifted in the temperature of the room. Bryn sat straighter. Spencer looked at the table. Rowan turned toward Vic. "Be careful with that word." "Or what?" Her voice stayed quiet. "That depends on how many more patients you plan to dismiss before someone documents your reasoning." The door opened. Dr. Solberg walked in with Darius's updated file and pulled out a chair without being invited. She set the file on the table. "I heard there was a review," she said. Flint smiled with all the warmth of a man trying to preserve a situation. "This is an internal process, Ingrid." "It's a patient safety process." She looked at Flint. Master Corporal Okonkwo had a clinically significant right pneumothorax. Delay of another 30 minutes would have put him in tension. Nurse Mackay identified the findings, escalated appropriately, and advocated for correct treatment over multiple hours despite active resistance. "I'll defend every one of those actions, in writing, starting today." Vic said, "Elise." "Ingrid," she said, "we've worked together long enough for you to get that right." The door opened again. Darius Okonkwo stood in the doorway in his hospital gown, with his chest tube drain hanging from one hand and his IV pole gripped in the other. A step-down nurse hovered behind him with the expression of someone who had tried everything reasonable. "I couldn't stop him," she said. Rowan was already moving. "You shouldn't be walking." He looked at her and tapped the air once. "I know." She said it anyway. "You have a drain in." He tapped again, slow and deliberate. "They need to hear this." Rowan closed her eyes briefly, then she translated. Darius's aphasia made his spoken words unreliable, but his tapping, now that she had his code, was precise. She spoke for him clearly, watching his hands. "He says he came in here 3 days ago because someone left a message on his door. He says the message told him his testimony to the tribunal next week would be his last public act if he went through with it. He says he came to this hospital because he trusted the institution. He says he was labeled before anyone listened to him." He tapped the air toward Rowan, then tapped his own chest. "He says," one nurse listened. Darius's eyes found Vic's. He tapped a sequence. Rowan's jaw tightened. She translated anyway. "He says, in places that people like Dr. Vic would not have survived past the first hour." Then his knees buckled. Rowan caught him before anyone else moved. She called for a chair. Bryn moved fast. Solberg grabbed the drainage line. Spencer stood frozen until Solberg pointed at him. They got Darius lowered into the chair. Rowan kept his eyes on her hands. "Breathe, stay here," he tapped weakly. "Not leaving again." "You are not leaving anything if you rip that drain out." Even through the pain, he almost smiled. That was the moment the room changed. Not because anyone respected Rowan yet. Respect took longer than one afternoon. The room changed because certainty had cracked. They had been sure she was soft. Sure Darius was impossible. Sure Vic was right because he spoke the loudest. Now Darius was breathing because the quiet nurse moved faster than the loud doctor. That kind of truth could not be unseen. They settled Darius back into step-down. Flint said the review was not over. Solberg said to schedule it when the witness was not attached to drainage equipment. While Darius rested, the hospital kept talking. A tech lowered her voice when Rowan walked past. Near radiology, a resident asked something about JTF2 that no one answered. In the stairwell, someone said Rowan had military eyes. Rowan heard all of it. She did not correct anyone. Correction invited questions. Silence let people reveal themselves. But a veteran in a wheelchair by the window looked at her wrist and then at her face and nodded once. The specific nod of someone who has recognized something they did not expect to find. That nod followed her all the way back to the unit. Because that was the real wound in the building. Not aphasia. Not a missing limb. Not nightmares. The wound was how many people had simply stopped expecting to be understood. An hour before shift end, Bryn found Rowan writing notes in Darius's chart. Vic is saying you manipulated the situation. She said it without conviction, like she was testing whether it was true. Rowan capped her pen. People say things that protect them. Bryn was quiet, then, how did you know the tapping, the code he was using? I recognized it. From where? Rowan looked at her, from when it kept people alive. Bryn looked at the floor for a long moment. Were you really there? Wherever he was? I was somewhere. Rowan picked up the chart. Does it matter for his care? It was not an answer. Bryn seemed to understand that. She left. Darius tapped the air when the door closed. She feels it. Guilt. Same thing. A pause let her carry it somewhere useful. The next morning, a woman in a Canadian Armed Forces uniform walked through the main entrance of Rideau Veterans Medical Centre. She was 60, silver-haired, with the posture of someone who had never learned to be tired in public. Her name was Colonel Adrienne Lacombe, retired JTF-2 command staff, currently serving as a witness advocate for the military tribunal that Darius Okonkwo was scheduled to testify before. She knew the name Crow. She had classified it herself 8 years ago. She stopped in the doorway of Darius's room and looked at Rowan Mackay for a long time without saying anything. Then she looked at Darius, then back at Rowan. They told me you were dead, Lacombe said. I was reassigned, Rowan said. To a veterans hospital in Ottawa, working under a different name. The work needed doing. Lacombe sat down in the visitor's chair with the careful deliberateness of a person managing something large. You know that with Darius's testimony this week, certain names are going to surface. Your name. I know. Your sealed status will not hold. I know that too. Then why stay? Rowan looked at Darius, who was watching the exchange with the focused attention of a man catching up on a conversation he had been excluded from for too long. She looked at the whiteboard beside his bed, which someone on night shift had updated. Please use the blue notebook for communication. Patient understands more than he can say. She looked at the corridor through the window, where Bryn was leading a morning huddle, slowly, carefully, and in a way she had not done yesterday. Because the work needs doing, Rowan said again. Lacombe looked at her for a long moment. Then she spoke in a voice that was quiet but filled the room regardless. Petty Officer First Class Rowan Mackay, CSOR Attached Medical Specialist, call sign Crow, discharged under sealed protective status after Operation Northern Shelf. She said each word with precision, and in saying it out loud, in a room with witnesses, she was doing something that could not be undone. 2 commendations, 1 classified. A service record that doesn't exist on paper but exists in every person she brought home. Spencer Rowe had appeared in the doorway. He stood with his chart half raised, looking at Rowan as if he were seeing the room for the first time. Vic had arrived behind him. His face was unreadable in a new way. Rowan did not look at either of them. Darius tapped slowly, forming each word 1 tap at a time. Rowan translated without being asked. He says, they gave her the impossible patient to watch her fail. They got the story wrong. The impossible patient had already been saved by her once before. They just didn't know what they were handing her. Lacombe said, the tribunal will want your statement. They'll have it. Darius tapped again. Rowan almost smiled. He says, stop looking so serious, Crow. You saved my life twice. Smile a little. I'm working, she said aloud, forgetting for one moment to translate. Darius watched her lips and understood anyway. His expression broke into something that had not been there when she first walked into room 7, a wide, unguarded, fully human grin. The room breathed differently after that. Weeks later, Rideau Veterans Medical Centre looked the same from the outside. Same brick, same maple in the courtyard, same coffee that the veterans near the windows always said needed improvement. Inside, things were different. Room 7 had a new communication protocol board. Bryn had requested ASL training for the entire unit and attended every session herself, corrected each time by an elderly Marine in room 9, who did not soften his critiques and clearly considered this a form of respect. Vic resigned before the tribunal findings were published. Spencer submitted a written account and began remediation. Flint approved a policy, in writing, posted at the nurse's station, that no patient could be labeled non-compliant without documented communication attempts in the patient's primary mode. Darius Okonkwo testified before the tribunal, his account delivered through a combination of tapping, gesture, and written notes, with Rowan interpreting, was precise and unshakable. 3 defense contractors were subsequently investigated. 2 names that had been protected for 6 years were not protected anymore. On his last day before discharge, Darius stopped his wheelchair at the nurse's station, the same nurse's station where the joke had started. He waited until Rowan was beside him. Then he tapped, slow and deliberate, giving her time to translate each word for everyone present. They gave you the hardest room, because they thought hard was something they could use. They were wrong. Hard is what you carry without anyone knowing you're carrying it. She carried it into that room, and she carried it out again. That is not a trick, that is not a secret. That is character. And character was always the only thing that mattered here. Rowan translated every word. When she finished, she straightened, she clipped her hospital badge level. It said, Rowan Mackay, no rank, no call sign, no classified commendation. Colonel Lacombe, standing near the corridor, gave her one small nod, not quite a salute, not quite anything official. The kind of recognition that passes between people who do not need ceremony to know what the other has earned. Rowan returned it. Then she turned back to the ward, because there was a patient in room 4 who had been waiting 40 minutes for a pain assessment, and someone needed to go in and actually listen to him. She went. People still told the story wrong afterward. They said the new nurse turned out to be military. They said the veteran with the brain injury had some kind of sixth sense. They said it was all about a conspiracy that got uncovered. All of that was true, but it was not the heart of the story. The heart was smaller, more ordinary, more important. A group of colleagues decided that a veteran's disability and a nurse's quietness were tools for entertainment. They expected to watch someone fail. What they revealed instead was themselves. That is the lesson that hospital did not forget. Never mistake silence for weakness. Never mistake gentleness for ignorance. Never mistake a person's restraint for the absence of everything that came before it. Because sometimes the person handed the impossible room is the only one who already knows how to open the door. And sometimes the patient that nobody would listen to has been waiting, not for rescue, but for one person willing to hear. Thank you for being here tonight. If this story found you somewhere across this country, from the Maritimes to the Rockies, from the prairies to the Shield, drop a comment and tell me where. I want to know how far the quiet ones travel. Until next time, take care of each other.